My name is Amber Scott, and this is my binder for OT 510, winter semester of 2025. So, starting off, I have the synopsis, which states within the course of 510, occupational assessment of neurological conditions, students were taught the role of the occupational therapist for a variety of different neurological conditions. Students were presented the material through lecture form, were able to participate in class discussions, take parts in hands-on learning through a variety of labs, and participated in simulations. Students were able to learn about the rehabilitation frame of reference alongside the NDT frame of reference and how these guide our interventions as OTs. Students started the semester learning how to evaluate a patient post-CVA and the variety of deficits that may come alongside of the diagnosis. Assessments include, but were not limited to, assessing posture and trunk control, language deficits, upper extremity dysfunction, static and dynamic balance, and sensory testing. Students learned the concepts of motor control such as plasticity, normal tone versus abnormal, how to assess a variety of tone and postural mechanisms. This course taught students key aspects of cognition and learned a variety of tools, both standardized and non-standardized, to use with patients to assess basic cognition such as memory or higher level cognition such as executive functioning. Students also learned a wide variety of different wheelchairs and what each part of the equipment was for. Students were able to learn what patients would best benefit from the various wheelchair accessories to promote overall functioning. Throughout the course, concepts of vision were taught and the value of a vision assessment for an OT was explained. Students learned about different core occupations and the assessments that go along with them, such as driving and sexuality. Progressive neurological conditions such as ALS, Alzheimer's disease, multiple sclerosis, Huntington's disease, Parkinson's disease, and TBI were taught alongside with the best assessments to give for patients experiencing the conditions at different phases of the disease. Students finished the semester learning about the value of a work hardening program and how to assess and help patients experiencing a variety of cardiac and pulmonary conditions. I also have the table of contents here, which kind of overall says what each week was. So now I'll go into the rest of this binder was my studying. This is where I study for all of the quizzes and midterm that we had. Starting with week 1, we have here, let me do it like this. So we have just the occupational therapy practice framework overview, everything, all the PowerPoints I put from the week in the same folder, as well as any of the handouts that we got or assessments. Week 2, ADL, IADL, also rehab frame of reference. And then all of the documents alongside. Okay. Week 3. This was the CVA week. So I have a hand wrote on all of the PowerPoints and sensory, and also the readings. Week 4, motor control, and again, just hand wrote all of the stuff. Okay. 5, This is our cognition. Okay. Week 6. This is our vision. Week 7, we did driving. So, week 8 was spring break, so that's just empty, just there for placeholder. And then week 9 was the sexuality. And then the readings. Week 10 was our simulations. So what I did was I imported what we needed for that week to read and go over, and I put my priorities here. Week 11. This was our progressive or degenerative diseases. I have them all the readings. Also TBI here too. And then I think I'm on week 12, which was cardio. So all of that. And then week 13, which was our work hardening. And then for our presentation, we saved me and my group mates saved our presentation through our shared docs, as well as I kept this in here just to cross-reference if I ever needed it and didn't have the paper with me. So that is my binder for 510.